Chickenpox. First of all, chickenpox has nothing to do with chickens. Chickenpox is caused by the varicella zoster virus. The disease is carried in saliva and mucus and can be spread when an infected person coughs or sneezes. When someone with chickenpox coughs or sneezes, the virus can be transported through the air to another person when they breathe in. Some symptoms of chickenpox are a rash, fever, and drowsiness. Chickenpox is the most common viral disease in children aged 6 to 10 and occurs in winter and early spring. Antibiotics and other medicines can be used to stop and fight the virus, and lotions and creams can be used to reduce the itchiness of the chickenpox rash. Aspirin should never be taken to relieve chickenpox symptoms. When people with chickenpox take aspirin, they develop a condition called Ray's syndrome, which can be fatal. Methods of preventing the chickenpox virus are covering your nose and mouth when coughing and sneezing and getting the chickenpox vaccine. In summary, chickenpox is an infectious disease. It is caused by the varicella zoster virus. It occurs in children aged 6 to 10 years old during winter. Symptoms are a rash, fever, and drowsiness. Chickenpox can be treated using lotions and antibiotics, and chickenpox is prevented by a vaccine and covering your nose and mouth when you sneeze or cough. Cystic fibrosis. Cystic fibrosis can be caused by any number of abnormal mutations in a single gene on chromosome number 7. The mutant gene is recessive, and it must be inherited by both parents to have a harmful effect. The symptoms of cystic fibrosis are breathlessness, wheezing, persistent coughing. The affected person may be constantly hungry yet underweight, and the ends of fingers and toes may become larger or broadened. Cystic fibrosis is a relatively common genetic disease. It is concentrated among people of Northern European heritage, and in Australia 1 in 2,500 babies are born with cystic fibrosis. The disease cannot be cured at present, but treatments are used to help control the symptoms. Some of these treatments are the replacement of Brock's pancreatic enzymes with dietary supplements, antibiotics used to control pneumonia and other infections, and postural drainage used to dispose of mucus in the lungs and bronchial passages. In summary, cystic fibrosis is a non-infectious disease. It is caused by abnormal mutations in genes. The mutant gene is recessive. Symptoms are breathlessness, wheezing, persistent coughing, and broadened fingers and toes. Treatments like enzyme replacement, antibiotics, and postural drainage help to control symptoms.